and Compete Now. And we focus on building websites for various organizations. And we had the pleasure of working with two healthcare association websites in the past year. We've also worked with a lot of other nonprofits and other similar organizations. So we're really looking forward to presenting to you all today. Really as some tips and some ideas, and also just, I guess this presentation, unlike some of the others we host, where that are on a little bit more specific topics, this is a bit of a show and tell presentation, is the best way I could phrase it. And we're hoping that over the course of watching this, it'll help inspire some ideas, because websites at the end of the day are never truly done. There's always something that could be improved or done better, and then eventually, sometimes when you do get to the point where the site needs to be overhauled and redone, a lot of these things are still good to know. So I'll let Garrett, you give your quick introduction, and then I think we'll get right into it and you know, get on with the content. And I should mention there is a Q&A feature in the bottom of the screen that you can utilize throughout the webinar. I'm thinking that we will have some time to go through some of those questions at the end as well. But Garrett, I'll let you go next.
Yeah, let's give a brief intro. So Garrett Dandreau, then I was my brother. So I work a lot on the development, WordPress kind of expert with building a lot of the websites. So I just enjoy working on the back ends and figuring out how to tie in a lot of different features together, whether it's just the front end of the design, making it look nice and easy to navigate, and then also building out some more advanced features like the calendars or directories, newsletters, and a lot of the other things will kind of get in how you kind of enhance your healthcare website.
Yeah, thanks, Garrett. I'd like Garrett to join. We were fortunate enough to be able to set up a more advanced one of the samples that we're going to show you. And yeah, I think that's why we work well with nonprofits. We're a smaller company. It's me, Garrett, and 10 others. So 12-person company, so large enough to handle a pretty decent sized websites, but small enough that we can be nimble. And also, I think that's partly what leads to us having nonprofit friendly rates. So let me share the screen here, number 4. And good. We talked a little bit about Compete Now. I don't think don't want to spend too much more time talking about ourselves. But we do have these core values of integrity, reliability, good communication, efficiency, solving problems, and commitment to excellence. You met us, and we're going to get right into it. So I did want to have a little bit of time in the beginning before we get straight into show and tell to just go through some of the key things to consider when planning for website improvements. This applies whether you're planning to make tweaks and changes to improve your website for the upcoming year, or if you're planning for a full redesign revamp. A lot of these steps I'm going to go through are very important, regardless of how in depth that process you're planning is going to be. And for our experiences working with other clients, some of the most successful ones really did spend time doing a lot of these things before engaging with us. It definitely made it a lot quicker to onboard. And as we started the process, it did help internally in the organization for everybody to understand, like, what do we want? What are we looking to do? And then once it's actually getting done, it's not news to everyone of like, why did we forget about this or that or the other? So I'm hoping that this will give a little bit more background for that. I try to put it into simple matters. These are things that could only be used internally or used in an RFP or something like that. But really starting out the process with having clear success factors or metrics in order of importance for the projects. This will help internally with departments or different leadership or employees, really getting a good feeling for if we're setting out to make these improvements and do this work, how do we know that we did a good job and we accomplished those success factors? And just starting out with that helps a lot to guide what are you even looking for in your website to make improvements on. What features are you looking to add, or what prompted this work to be done? And then when you start working on it yourselves, or if you bring in an outside vendor, it does really help us from the start to understand, where does the effort need to be focused on. Simply listing out the key audiences for the website in order of priority is also beneficial. We did this for all of our clients where it's, it helps to have either the CEO or some of the top level management go through and talk about their priorities, and then also figure out does that line up with why we're even setting out to do the project? Because it can be difficult to work backwards if we're missing some of those key things. But if you do get those audiences in order of priority and everybody agrees on them, then you can start breaking out what does a successful website experience look like for each of those key audiences, and what are we hoping to get them to the most quickly, and what do we want them to do. This is a little bit of a simple one. Some organizations we work with will have, 10 to 15 reference websites that the organization likes and notes about each. Some will be like, oh, we haven't even looked, so we just know we want ours to be better. But typically, if you do spend the time to go out and look at some other similar organizations and just say, we really don't, we like these couple of things, but that's about it. That can be still helpful as for you internally and for any third-party vendors to understand, what are you really looking for in the website, and what are some key things that are worth highlighting. Additionally, notes about the status of the branding and logo and design assets is helpful. So if you're going into revamping the website, or if you want to make some changes on your own, it is a good opportunity to look back and say, is this really where we want to continue, or is there an opportunity for some improvements at a core level of the branding and logo and some of the other design things? And that kind of will also lead you into heading into it after you look at those reference websites that you like. What is the availability of images or videos on the website? If everybody on the team is sharing sites with these beautiful pictures taken at events and videos talking with members and things like that, you kind of realize, well, if you don't have the availability and you don't have the inventory of that type of content for your new project, and that ends up being a success factor of having an engaging, inviting website with that type of content, then you know that either during the process of improving your website or before you even start, you might want to start working on that inventory of assets. Because once you get started on the website, you don't want to power through the process and end up with low quality images used throughout the website, or just stock images that are really do not send the message that the whole team was really looking to go for. Very important to think about that ahead of time, because yeah, that's the biggest disconnection. And if you look at a lot of healthcare association websites, you do see a lot of iPhone candid kind of pictures used on large banners and things throughout the website. And that's usually when, regardless of how well the structure and the design was done, those images can really bring it down and keep it from looking like the true upgrade, or really matching the level of quality that the organization is striving for. Separately from that, just getting some clarity on what's needed is helpful too. So creating a simple list of functional requirements of the website is important. What do you need it to do? Experienced designers will understand that. And at least if we know at a core base what you want it to do, you can kind of line that up with solutions that sometimes might not even be that complicated or costly. Or if you're doing it internally, you might take that list and say, we can kind of do that on our existing site with a couple of steps. So that's important to do. And then if there's a separate list, are there any other offline? This is what you see: integrations, donations, event management. Is there anything happening where there are multiple tools now, which would be better to be streamlined through the website, or can be better integrated to the website on that go around? You'll often see a lot of these association websites will link off to separate websites or third-party tools. And over time, depending on how your site is built, it might be able to be possible to better integrate those and make a better experience on the website itself. Also, as you're planning for a website, either project or improvement, this is where we see a lot of healthcare types of sites just completely growing out of their existing navigation structure. And you end up with way too many items in the top level menu and way too many drop downs and sub drop downs of drop downs. How can you go into it and start thinking through, based on those sample websites, how can we better organize that? So that actually, I will make sure when I share the screen of some of the websites that we've done recently, I'll show. That was one of the biggest processes, was kind of really reeling in that content, and I'll show you how we organize different buckets of information on those websites too, to help you, inspire you, hopefully. Also, if you are, this is more so related to if you were putting this out for an RFP or something like that, just stating if you have a preference for how the site should be built, if it's worse, WordPress, Squarespace, or otherwise, or Wix. It's always good to let the providers know that. I do have some slides later on in the process that Garrett will cover, talking more through WordPress and some ins and outs of that. If you all like to stick around for that. All right, and then just providing some information about the existing site is helpful. And if you have a preferred process, letting them know. So I did want to just include that. It's a very wordy slide, but I do plan to send out the slide. So I kind of erred on the wordier things, hoping that it would be more useful once you do get the slides. This is another one that is just a really wordy slide that I wanted to include, but is so many of the organizations are on multiple versions of the site. Maybe this is your fourth or fifth site by now for the organization, and content archiving is coming up more and more. So thinking about this earlier on in the process is important. You know, basically deciding all out of all your older news items, how many of those do you need to keep? What can be archived? And then really creating a strategy around out of everything you're deleting, where should those URLs then forward and redirect to? Because you really don't want to create a bunch of issues on your website that create not found pages, 404 error pages. So as you're removing and archiving content, trying to decide where should people go that were trying to find that previously. And the same works for events. These are especially, sometimes news and old blog items actually are pretty useful, even years after the fact. But typically events are not all that useful. So a lot of our clients have been, only keeping about 3 years worth of events, or even 1 year worth of event, and then having all those older events redirect to a page that explains this event is passed. Please click here to proceed to our upcoming events calendar and learning more about our organization. So I did want to just note that as well. All right, so now that we're past that, I do want to get into more of the show and tell portion of the presentation and go through, firstly, healthcare association sites we've done. And also, I'll share a few other relevant examples just because, depending on your association, it seems like there are needs of these association sites that kind of fall in line with other similar kinds of sites that could be useful and beneficial to you. So the first one I wanted to share was the Maine Medical Association. This was one of the ones that we worked on in 2024 and just got up and running in the fall. And I will share that on here. You should be able to see this now, Garrett, right?
Yep.
So just some things to point out about this site as we're sharing it is the navigation. It has a really nice kind of landing page with the background. So basically tying in that Maine is such a beautiful place to live. One of their missions was they wanted to attract more physicians to Maine. And there are a lot of pictures throughout the website kind of showing those areas and those backgrounds and different things of Maine to get that landscape incorporated into it. And then you can also see the navigation menu. And this seemed to be a pretty good way to organize a menu where there's lots of things. So affiliates seem to be a common need for healthcare associations. How do we get them, even though they're separate organizations, how do we get them more prominent place on the website? I believe previously they were under About. So being under About is obviously a little bit harder of a place to find those affiliates, and they can tend to get a bit buried. So here we put them right in the beginning where you can kind of find the three affiliates that they have. Then there's the programs. So that was where we separated the affiliates from the programs that they offer. And then you have a membership page. And I'm going to cover this a little bit later on too, but also member benefits pages seem to be fairly common, that a lot of these healthcare association sites don't have an explicit member benefits page. So that's important to have. So I'll be sharing a little bit more about what to include on pages like that. A separate page for advocacy and education, and news and calendar and resources. So whether it's public or for the members themselves. So this was a good way to kind of organize the navigation menu and then also have some of these supporting links in a separate menu above, whether it's login, renew, join, language switcher, donate, some of those other, you call them the utility links. And then I'll just kind of scroll down a bit. You see we have the statistics area, which helps a lot to get an idea for the size and scale of the organization, get some immediate credibility. Above the fold, this is a very common thing, and I'll highlight because on healthcare association sites, or pretty much most member sites, you do see a fairly high percentage of repeat traffic. So having this spotlight type area where highlighting some of the recent or most latest um, featured things is important to include on the front top level of the website so that as members are coming, and maybe they're only coming to go straight to log in, you can still capture their attention with some of that recent news. So you kind of see it's almost like halved, where you have, okay, if you don't know us already, here are some important things to know about our mission. And if you're coming back, here's a spotlight. Although this, I'm sure this isn't uninteresting to the people that are first coming to the site. And then as we scroll down, you have some quick jump links. So this is where, as you're evaluating websites that are of interest, you might start discovering that, our audiences are coming to our site for, in this case, 6 things, these main things, and how can we get them quickly to those pages deeper within the website? So that's was the strategy here, having this kind of very simple icon and headline and link type of option. And then as we scroll down, you have an area for latest news, upcoming events, and a spot to advertise. So that's another thing that a lot of websites are adding now, are this ability to allow advertisements on the website in a subtle way. And what we realized that the easiest way to do that, instead of asking advertisers to provide like a static image for the advertising spot, they're still recruiting their first advertisers. There's a spot for a smaller image and then a headline and subtext and a learn more. And that's mobile responsive. So it allows you to start offering advertisements on your website from potential partners without really needing to have that, usually ugly block that is not mobile responsive and can really, affect the overall design of the website. So those are just some of the things that I wanted to highlight, at least at a start from this sample. And Garrett's going to be sharing a bit more about the login and the join area and so on. So the next one that we wanted to show and tell, which we also did last year, when we say we did 2 last year, this was the other one, is the Massachusetts League of Community Health Centers. And this was an interesting one because this was one where it was something that the organization had thought of for many, many years of upgrading, and they had done it internally in the past. And then finally, we went through the process, and then it was pretty shortly into the process we realized, okay, it's not just the website, it's all the content and everything in the whole site needs to be reworked and updated because it had been put off for so long. And they did a great job working with us through that. But for here, there's kind of that static message on the side, the collective voice for advocacy on behalf of community health centers. So it was really important that they wanted to really demonstrate the impact that these community health centers have on the state, and then just highlighting how they really are so active at all these events and all in the community, and kind of highlighting that through photos on the right side there. So you can see it's a little bit different, where on the Maine Medical Society, it was more pictures of the landscape in the background, whereas this one's more, here's us in action and pursuing this. So that's all part of what you'll work through when you're planning for the website and really defining what do you want the tone of the overall landing to be and how do you want it to look. So you could really see that this one is much more, when I compare the two, this one is more focused on, the mission and how we're attracting these physicians, whereas this one's more, they're much more into that advocacy. Like, we're representing our members for all these different things because they have such an amazing impact on the community. And then as you scroll down, you still have that spotlights area really prominent here. And then as you go down, you have the league's mission here, and then into the programs and initiatives. So it's a very quick scroll to get through the spotlights and then into the programs and initiatives. And even organizing these was interesting because they had so many of them before. and we had to get it down so that each of them had more of their own landing page presence on the website. And that's another thing that later on in the presentation, I'll have some more time to highlight. How do you handle these big programs that have many, many subpages deeper in your website? And how can you make that as easy as possible to navigate? You'll see we actually did the Mass League site after we had mostly done the Maine Medical Association site. So I feel like this one even got a little bit drilled deeper into simplifying the menu so that we had about, affiliates, members, programs and initiatives, public resources, and news and calendar. And the members section was very important to add because they didn't have a very clear section for members in their previous website. So that's how you can see we have member benefits, frequently asked questions, the list of members, how to join, and then a link into the member portal. So that was an interesting way that we were able to add in that feature of like, okay, a lot of members are coming to the site, and some of them are members by default, and they don't even know why they're a member or what the Mass League does. And this is a quick way to kind of launch them into those sections of the site and then get them into the programs and initiatives. Because really, the programs and initiatives are all member benefits, but that doesn't necessarily mean the members really know that. So that's where we built in that member section. And I'll kind of dig in a little bit on what we did for the member benefits page too, as well. So those are the two association sites that we can cite, and then I'm going to go into some of the unique features within those sites in a bit. All right. And then this is one of those ones I wanted to at least highlight because it's related where it's healthcare, but they are also a nonprofit. So this is the Boston Healthcare for the Homeless program. So this was an interesting one because it is somewhat related, and this was one of the references that the Mass League really liked, since it is one of their members. But you can see here how it could be relevant, where you still have the about, services, careers, news and events. And I'll just highlight some of the things that we were, most proud of on this website in terms of featuring stories on a homepage. That's also something where healthcare associations would find use for a slider like that, where they can control the news that's featured easily from the back end, a link to view all. And then as you go down, that recruiting kind of message, and then a bit more about them. And then as we go in, kind of filtering. So if you have a lot of different services or programs, a way to kind of condense that into a menu with 2 columns. So that's one feature. So if I go into medical care, you can kind of see a landing page. And I did want to highlight this as an element, how they have this kind of lander for the medical care. So if you have a parent program, you could have the main program with some overview information, and then those sub-page links that go into the deeper pages. And then when you click into the deeper page, you still have this area to highlight that background image overview. And then this has been very helpful on a lot of these nonprofit and association types of sites and healthcare sites, where sometimes you have programs that have lots and lots of information and some not so much. And adding tabs like this, where you can see as I click through all 3 of those, it makes it so that you can really organize the content into those tab sections. And some pages might have 4 or 5, and some might have 1 or 2, but the layout stays the same. So you end up with that consistent layout throughout the website, which is very beneficial for the users. And then also, as you're adding news and stories and things like that, you can tag information. So what this is doing here is that as all of these stories are tagged as being related to primary care, and then they automatically show on this page. So even though they're on the main page for news and events, they're also showing up automatically in this section. So that's a really good feature that, especially for healthcare associations, you're putting out so much content and news and updates and interesting information and stories. This can make that content go a lot farther and get automatically fed into deeper pages throughout the website. So that was some of the reasons why we wanted to highlight that. I also like the find the services page on the site in particular. So allowing people to search by keyword or filter by service. So I could definitely see that working well for a lot of associations that have a ton of programs or information. How can you make those easier to sift through on one page? So that's what this find services page is, allows to search by specific keyword or filter down or other various things that you can make possible for the users to use. All right, this one's another one. I really like to show this one, this Health Equity Compact. Hold up here. Just because this is another one where, you start to think through what is the message you want to send from the homepage. And then in this particular organization, they're really out there advocating for this cause towards health equity. And that's just a great way to really put that out there and kind of show them doing things and helping getting this bill passed. Always really like this slider, so we'll highlight that on later in the presentation, but this was a good one to kind of show where the members are from. And then you can see here they have a lot of images and things like that that really when it really has that bigger impact showing the real people throughout the website. I always like to click through this one because it just has so many, pictures of them doing these different things. And you can see here, it can be a little tricky sometimes where you don't want to deal with those panoramic pictures throughout the website. So this was a nice design technique that was used here where it's more so the half the page is being used for the page title. And then you have this little decoration and then the photo on the right, so that you don't have to have those, big pictures and worry about faces getting cut off by a heading. So that's just a little design, technique that I figured I could point out to you all for there as well. All right, and then you have a take action page. This is more of a landing page. And then a sign up for alerts is very, important to have in helping build up that email list. I feel like a lot of the association sites, it's always good to have a prominent call to action to sign up for alerts and build that email list and keep people up to date. All right, this is another one. I mainly wanted to show this one for this purpose. This one had a nice quick links area that I always thought worked well. So you have kind of this bottom aligned headline, and then you have the scrolling images. But then as you scroll down, this bar that just launches people into the main sections of the website, and then that quickly lets people get into some of the latest news. So that was always a quick way that we did the site a few years back, but this is a quick way to get those links there. That's very effective. And then you can kind of see this other navigation menu style that can work well for sites that have a lot of deep content. It's a full takeover of the menu, and then it has these nicely organized columns to kind of get into these different areas that they provide. Another area that would work really well for a healthcare association site, which is why I wanted to share it, especially the tools and resources one where this could be, public resources versus, member resources or something like that. So that was that one. And this one had a similar look and feel as the LOL, so that's why I included that. Also, just want to give some more context to when we say learning from experience, what we can include is, that's definitely an area to put that in. And then this is another organization we worked with that was a member-based organization. And I always like to highlight this one because they had a strong call to action on their homepage. Never miss a program, sign up now. And I think this is also helpful for healthcare associations that, you have a lot of members, but maybe there are some members that don't have their own logins or aren't actively getting email alerts and updates. So just really having that prominently on the homepage is beneficial. Just one more here, Special Needs Advocacy Network, Inc. This was a good one where the site was integrated with Growth Zone. So this is another separate member management program. One of the most important areas of a lot of these sites is on the events calendar. And I always like to use this one because it really showcases all the features you could have with an events calendar. So if I go here to view full calendar, this will actually allow you to organize events by multiple filters, and they're all custom. In their case, they needed to organize by committee, chapter, and event type. And I do think that could help with members navigating upcoming events and other types of workshops and things like that as well. So I hover on here, you can see it automatically refreshes and shows if there's anything upcoming for those different committees. So that's good. And then also you can filter by chapter, or you can filter by, this site was published shortly after or during COVID. So there was still, I'm not sure how many, I guess virtual is still helpful to see what's coming up for virtual, but hybrid was much more common at that point. And then you can kind of scroll through them there. And then when I go to those committees, I just want to show one extended thing that's nice to consider. If you do have committees or specialty groups within your organization, that from that calendar, if you're tagging properly, any upcoming events, like right now it says next, if they had one that was upcoming, it would show here. And really just automatically filtering those meetings and events based on that committee was a really nice feature of that calendar. Bit of sample. So I always want to show this sample too, because on the previous one, it was more of a list view, whereas this is a nice monthly view of a calendar. So if you're having a lot of events over the course of the month and you even want to color code them, you can within the calendar. So that was a nice thing that we always like to highlight as a potential. If you have a calendar on your site, how can you make it, as easy to use as possible, based on the device that your users are using. This was the one that we shared before, but whenever you can use statistics, can be very beneficial to show the scale and types of members you have. And in their case, they have 1,000+ CME credits offered annually. So that was a big selling point for the members, a huge membership benefit. Another one, this was showing more who they're representing. This was an interesting one that I wanted to highlight, and that'll be useful when I share it. But let me show you that. This was a technique that we worked on most recently, where when you go into these pages and they have these long scrolling pages, you can actually set it up so that these sidebars actually follow the user down the page. So we have on the here, it makes it really easy to navigate to all the about related pages. And then as you scroll, no, it's not doing on that one. Let me go back here. Page is too short to do it on that one. So is that? I'll have to just show that in the video. But now you know what you're looking for at least. So go back. Here you go. So you see as the user scrolls down the page, this stays locked here. So that means even as you get down to the bottom of a really long page, you can easily use that left sidebar navigation to navigate to the next page and so on. So that's been a very good user, friendly thing to make the site easier to navigate, especially when there's deep content. Also want to highlight these mini sites. So this one is an example on the workforce training. So you can kind of see as you scroll down, there's so many sub pages within that program that you can click into. Pause that and I'll show you actually on the live site so it's easier. So this was one where some of these programs only have one page, but this almost basically made a mini kind of like homepage for this workforce and training department. So you have the main landing, the image on the right, they have their own stats highlighted, they have overview information, and then here are all the sub pages within that program with images. So it really makes it into this kind of mini site. And even if they had their own URL, or sometimes you'll see organizations like this where these departments will have their own separate websites and then they get consolidated into the main organization site. And then you can forward that traffic straight to this main landing page. So that really works well to organize. And then once you get into one of those sub pages, now you don't have to keep going all the way back to that main landing page because you have that feature on the left I was just mentioning with that sticky sidebar menu to really learn more about it. And then we keep a link back to view all of them. So that was just another way of doing that. And then within the pages, having these nice tabbed elements and other ways of organizing information always becomes important to allow for the departments to say everything they need to say, but still somewhat formatted into nicely laid out pages. And I did want to highlight the member benefits page. So seems like the best way to do it is to feature a quote and then having these kind of toggles that can go through the different benefits. And typically, as you can see on here, a lot of those benefits do help to add some more internal links to help the members. Okay, I'm interested in that benefit. I want to learn more, and then click through the site to that next page. So I'll show that on this one here because that was going a little fast. So it's kind of like a member benefit selling page. Quote from the CEO, president, and then into the what do you mean by that meaningful connection? So that's where they can go and visit the member only community forums. So it's really a good way to use these member benefits pages to guide the members through the site and understand better what they could be taking advantage of that's offered by the association. Language switcher. I think a lot of the people on this webinar probably are familiar with these, but incorporating that on the website can be helpful to allow for simple translation. And it's, mostly through Google Translate. Some organizations do a manual translation, but you can see it definitely translates everything really quickly. And it's just important to make sure that you're not using any images that have text on them. Otherwise, it really won't work very well. But as long as the website's built in a certain way, these language switches work really well and are a typical request of a lot of our clients. Quick links we covered. You can kind of see here, this is completely unrelated to healthcare associations, but it was a site we did years ago for a chamber of commerce. And you can kind of see ways to incorporate some of those quick links into a header. So they have become a member, business counseling, and then they have quick links here, pay online, member login, join a newsletter, local deals. So it was a very interesting strategy to get a lot of quick links in a way that looked nice for the key calls to action throughout the site. Sponsor feeds, just more so just to show different styles of them. Frequently asked questions. That's another great place if you have membership and become a member, and there are some qualifying questions that people might have before they know if they should even fill out a survey or a form to begin with. It's good to have the frequently asked questions there or anywhere else on the site, really. Tab content we talked a little bit about on the Boston Healthcare for Homeless program site, but the tabs just help a lot with making the sites easier to digest without having to do a long scroll down the page. All right, so I've been going on and on. I know that we wanted to cover the membership part of the site a bit, Garrett. So you want to talk a little bit about that as
Yeah.
well? Do you want to share your screen or just go off of mine?
Yeah, let me see if I can share my screen so I can show a few things. And I think there are some other features on some of the sample sites I think we could kind of highlight that are kind of enhancements to the site, not just content related. So
yeah, even if you just want to share the sites, like I have the bullets of what the plugin does, but if you want to share what you did for MMA, that'll probably be even more interesting to the audience.
yeah, I'm gonna do that. Let me send that request. Then
Okay.
you pull up the screen after, make sure I
Yeah,
don't miss anything.
there you go. You should be able to share.
All right, yeah. So this site had a lot of the features that normally we would want to incorporate. Starting with just the membership plugin, they had a database of about 4,000 or 4,300 active members that they had separate from their website. And part of this project, we incorporated them to be the database became part of the membership plugin within the website, so people can log into their accounts, they can pay their dues. They can register for member-only events. So if you have events and if you want it to be publicly available but have discounted tickets for members, you can kind of tie that into the membership plugin. And we have a whole membership side of the site. So if we go there, you can see when you log in as a user, we had the members portal here, and we have the renew button up here. So then you can view when your membership expires. You can pay online and renew it for another year. People that sign up can, if they're not a member, when they're on the main site, if we go back to the main site, can go here. So we have some conditional logic up here. So when I'm logged in, it has links to the members portal, my account, log out. But when you're logged out as a user, you'd be seeing join and log in. And when users go to join, they can select their membership types. They can be a new member, MDDO, part-time member, senior, retired. They have different membership levels with different rates and different rules for that. But that would allow people to kind of automate the whole process. So as soon as they sign up, it goes into a approval process. So a membership chair would kind of review their application, see if they're able to be accepted. Once they accept, their membership's automatically created. They're all synced into the database, and it's all much more automated. So everything's tied in together right with the website, and they can log in and update their profile and all their information. They had about 40 different kind of custom fields that they were collecting data just on like their specialties and their preferences, what they're interested in, and where they went to school. So just a lot of the key information that's tied to their account. And then there's also a feature here that has kind of slowly getting some use here. If we go to the public resources, is like a member search. So since it was a newer feature, it's more of a feature that people are going to start opting in for. If they want to be found publicly, they can be listed and their information can be kind of found on the front end by people just visiting the website, whether accepting new patients, where they are employed, their gender, county. Then there's some search and filters here, so people can search for like an ophthalmologist, and then I'll just show anyone that has opted in. So that's like a feature that a member can enable. If they want to be able to be included in this directory, then they can be included here. So obviously they have over 4,000 members, but something that's slowly gaining a little bit of traction as people start to check off that box to be shown on this list.
Mm-hmm.
And also in the members portal, some other just nice features that you can kind of tie into this tool. We use a WordPress plugin called Paid Memberships Pro that kind of has a lot of these features built in, a lot of integrations with other tools. That's where we have the members only forum. So only members can access this side of the website and post in a forum and create new topics and go back and forth. And you can see we have some other things in here like submitting a job. So you can submit a job and post that to the website. They also have like a newsletter that's tied into the website, so you can send member-only newsletters out to active members, which is for them in this case is done weekly. So that gets sent out and automatically gets sent out to the same membership database. So a lot of different features in here, and then also like a classified, so people can submit a classified if they're looking to sell some equipment or looking for something in particular. Member can go in there and do that. So there's a lot of interactive type features that can be tied into the member side of the website here using that plugin. And another good reason why we like to use WordPress is just so flexible with how many different plugins there are, very customizable. And like in the future, if they wanted to add another feature to the site, then it's not like a large overhaul to add a new feature right into the existing setup and framework.
Yeah, no, it's definitely there's so many great association management softwares out there, but it was they weren't necessarily wanting to go that route. It was exciting to build something more custom using WordPress, and now as they do come up with exciting ideas of feature requests and things like that, it's not like the feature request bucket in most software companies where it's probably just drops off into the middle of nowhere. So that's pretty interesting and exciting.
Yeah, and then in the back end, just certain admins can kind of manage the membership in the back end. So it's very easy to use interface. So if you have members, you can go in here into the back end and view their expiration date, their membership level. And then if you click into them, view all their additional details, and everything can be exported into reports. And there's also some back end reports just to show you how many times people are logging in, how much activity there is in the back end. So you can see which users are active and kind of track how many people are logging in on a monthly basis. That's another big thing. They had like a database, so they had no idea how often people were actually using it, if it was getting any use. So it's nice to have those reports.
Mhm. Awesome. And then do you want to just share a little bit about the newsletter, and then we'll go on to the next?
Yeah, let me go through and see what else I have in here. So that's what we like to use, a tool called MailPoet, which is another WordPress plugin, and that allows you to create newsletters right in the back end of WordPress here and send them. You can see like their weekly update that goes out and how many people are getting it. And so you can create different lists, almost just like regular MailChimp or Constant Contact. You can create lists and have everyone in here. And the nice part is it's connected right with the membership database. So when someone signs up and renews their dues, they're automatically added to the list, and emails can be sent out to them without having to manage them in a separate place like MailChimp. It kind of just keeps everything updated well. And they have a lot of their news posts, like the spotlights, automatically kind of feed into here. They like to update their images in the newsletter to kind of reflect the season, kind of keeping that theme going with the pictures of Maine. And so you have their spotlights and just news, legislative highlights. You can see like up here some of the top items they have with images. And then we have more bulleted lists like Maine news updates of the week, world updates, and then featuring upcoming events right in the newsletter as well, and also job opportunities. So a lot of the features on the front end with spotlights, a job board, upcoming events, it's all kind of tied right into the newsletter. So all the data is kind of getting delivered to someone right in their inbox every week as well. And without having to fully make all these from scratch, it kind of pulls them all in automatically with some nice features. Then it has stats as well. So you can see their click and open rate. They have very good open rate. Like 70% of people are opening their emails and clicking on things. So you can see the stats at the end of every email as well. Then other features I want to show is when we're on the Mass League site, like some of the top call out buttons that we had. They had to donate and then also find a community health center. So two of the main things that people come to the website for. And this is one of the big ones, is finding a health center. So that's for people just looking for a health center here. So you can come down here. We have the map of all their members and their contact information listed down here with their address, phone number, website. These icons kind of show what services they provide. So you can filter by service and filter by dental care and find everyone there, or search by zip code, and that'll all refresh right in the map, and then update the list of health centers shown there. So just another kind of feature that we had built into here. And the careers was another big one where a lot of people are looking for jobs at health centers in their network. So you can see just a large job board, and that allows people to submit jobs into it, and people can review it and approve jobs and get it up there. So it's just another feature I wanted to kind of highlight there as something you can use to enhance your website.
Awesome. All right. So yeah, that since we were talking a bit about WordPress and how we built that, I figure we'll kind of talk a little bit about WordPress for the people that are interested in that. Let me see here. I gotta get this out of the way. Can't even tell which screen should we show. Let's see. And then we'll wrap it up. If anybody has any questions, please feel free to add them to the Q&A section. And I'm going to try to get through this last part pretty quick so that we can still have some time to cover those as well. Yeah, there we go. All right, so if you're going to be working on a WordPress site, whether you have one already or you're considering getting one, just some considerations to make sure you're working with up-to-date, trusted, well-documented plugins. Paid Membership Pro is one of those. Building it for ease of use by all, detailed training resources, dynamic content strategies. We talked a little bit about how you can feed in events and news by topic. So there's a lot of good things you can do with WordPress. And then also prioritizing fast load times. Users aren't getting any more patient as time goes on. So we need to make sure those pages load as quickly as possible, so that if they spend, a minute on the website, ideally, 55 seconds there, 57 seconds of that over the course of 5 or 6 pages is all actually visiting the website, not waiting for pages to load. WordPress is great. There's a large community of users, so it's not hard to find people, either new hires or agencies that have experience with it. Scalable, just about anything is possible. We were able to build that. Gara was able to build that membership site out using WordPress with all the features that they needed, instead of them having to pick some kind of like association software that they would have to kind of bend to. They kind of really got a customized version of what worked best for their organization. And like we said, large community, and obviously additionally used by other organizations. Main steps to ensuring security. If you do have a WordPress site, you're going to get one. Just make sure you stay on top of WordPress and theme and plugin updates to keep those up to date and secure. Getting quality WordPress hosting, Typically with WP Engine is what we recommend is also really beneficial. And then keeping up with additional maintenance and securities over time. Didn't want to go too far, but paying attention to ADA compliance is also important. Make sure the website is accessible, also to avoid any complaints or, we've heard about different organizations with different problems with that. So really making sure that the website is accessible as well. And then incorporating a tool like this Userway is free. It doesn't make your site ADA compliant, but it does show a commitment to trying to improve the website. So once you get everything done with the site to make sure that it is ADA compliant, adding in an accessibility tool like Userway is a great way to do that. And that just adds a little widget at the bottom of the screen like this, where you click that and it, allows you to make the text bigger, highlight links, make more text spacing, do whatever you need to make the page easier to read and navigate. This I just wanted to share. We did those accessibility recommendations and use that tool on this website, and this was feedback from a live user. Very easy to navigate. I'm a quadriplegic and I use voice activation software and it worked just fine. Also, phone service was great. So I always like to share that feedback just to know that people that really do have disabilities trying to use the websites, if you do the right things in the right way, it actually does benefit them and they'll be able to use the site. So we appreciate you all hanging around for this. I'm going to take a look at the Q&A and go through there. I managed to save 8 minutes. We threw a lot at you. It truly was just a big show and tell, hoping that something will spark some interest or ideas that you could use yourselves. Let's see. This question is regarding integrating current software with the website platform. Are you able to design a website with current software that we use for events and membership? Are you able to work with certain software? Typically, that's another great thing about WordPress is typically with WordPress, if there is an integration available off the shelf, there typically is one for WordPress. So oftentimes we do, work with a website to redesign it. And then if we can integrate it with a third party, we'll actually go down that route and meet with a third party or go through the documentation and do our best to integrate it into the website. And if there isn't a turnkey one, we often can say, as long as they have an API or some kind of access for us to create a custom plugin within WordPress, then that can all work. And the good thing with that too is it keeps the website independent from that software, so that if you go a year or two down the road and you say, wow, we really don't like this event management software anymore, we want to change, then at least your website is still the same and you can just swap out that tool. So I hope that helps to answer that question. Next one was after the site's complete, user admin access granted, future changes, adding new events. Oh yeah, of course. So whenever a website is complete, the organization should have full control over content on the website, events, news, pages, pretty much anything you need to do to administrate the website is documented and easy to do. And when we do the website, we also provide video training tutorials for how to do it, so that as you add more people to the website and you want to give them certain user roles and access and edit certain things, that's all very customizable, so that it can make it so that the whole organization can edit the website within what you want, but to be really easy to use. So those are a couple of the ways that we work with clients to make sure that once the site's done, it is not just something it's a tool that the organization can use moving forward. And that's especially true for member organizations, healthcare associations, and nonprofits. There's always a million things to do on the website. So we try to enable and empower our clients as much as possible to do that on their own. And then we do have support packages. If bandwidth becomes an issue, then we can also play a role in helping with those efforts.
Yeah, I guess just adding in you can kind of create custom roles if you don't want full admin access. You want just access to where you want to add events or have certain people have limited access. There's definitely a flexibility within WordPress to create custom roles and grant only access to certain people, so they don't necessarily have to touch every single page, just specific pages or just events. We can set up a lot of those.
So I just realized I should have recorded my answer. Yes, we can. Thanks, Garrett. I'm just putting in these, and then I think there was any information similar. Is there any information similar to this that you can share with me? Sure. Yeah. So I think what we'll do is we'll share basic information about us, and then this was recorded. So I'm going to share the slides and this recording as well. And then and then of course, usually I think we would go out saying we're definitely open to meeting with organizations, and hopefully we enjoyed working with those other two organizations, Maine Medical and Mass League, so much last year. We're hoping to work on another one at least this year, to forward our learnings and keep it going. So I'll definitely follow up with you separately about, any other information you might need that might be helpful as well.
Yeah, and then there's one other just quick note on any other features is one that we get a lot is people that are looking for LMSs or learning management systems for like an e-learning center or a CEUs, CMEs. That's all stuff that can be tied into WordPress as well with obviously another plugin. But pretty much any feature you can think of, it's usually either a plugin that's there that we can use and customize, or a custom solution can always be built.
Awesome. Well, good. So I have a couple of follow-ups to make, and I think that's all the Q&A. After the meeting's over, you should all get redirected to a feedback survey plus an option to, if you wanted to meet. No obligation, but if you want to do a quick review of your current website and brainstorm some ideas, I'm just looking to network in general. So, and if it does lead to anything now or in the future, then that's great. But if not, just happy to meet. So I appreciate you all joining in today, and hope you enjoy the rest of the week. And we look forward to talking to you all soon. Thank you.
Thank you.
Thanks, Garrett.